Wait until you hear this update. The pollen, as you know, piling up. Millions of people are miserable, coughing, sneezing, sniffling, especially harsh in New Orleans, with the Allergy Foundation of America ranking the city in the top 10 most challenging places to live with seasonal allergies. And Dr. Reena Mehta joins us to identify the challenges as we enter peak allergy season. And we say top 10. But they're saying top 10, Doc, and then they're saying number 2 in the country.
So
tell us about
in
that.
2025, this report showed that New Orleans is the number 2 worst city in the United States to live for allergies. Last year, we were number 34. So we have jumped up.
What happened?
I know, I don't know if to be proud or sad about this.
Yeah, exactly. This is not the list you want to be top of.
We talked about in the fall, we had Hurricane Francine, where we had a lot of mold and humidity and dust. And then November was a very warm month for us.
Right.
And so because of that, whenever we have heat and humidity in the subtropical climate that we live in, it fosters the growth of pollen. Pollen, dust, mold. We really don't get a break here in New Orleans, except for maybe those couple of days we had snow, but pretty much that's it. And so because of that, pollen is a year-round issue for us.
I mean, we're talking about it every single day. I mean, you see the list here, or I do anyway. Wichita was first, we're second. All these other random cities right behind us. Greensboro at number 10. And you think of places that have more tree growth and things like that, but really everyone's talking about it right now. Where's all the problem coming from? The pollen, what else? The grass, what else are you finding?
So this is the time of year where we really see a peak in our pollen. So grass pollen, tree pollen. Tree pollen is like our biggest culprit right now. And that's usually an issue. You know, for us, it starts earlier than other places. So we're looking at February through April.
Right.
Grass pollen is also an issue that goes from basically May till June. And then we go into our ragweed or weed pollen season in the fall. But again, we don't really have seasons here. So a day like today, you're going to see trees, pollen, you're going to see grass pollen, dust mite allergy is really high today. So, you know, if you're an allergy sufferer, this time of year is kind of miserable.
Okay, so you have new customers at your clinic. Definitely, this is the year for people suffering for the first time if they haven't before. We see these asthma inhalers here. Some of the complications that come from this, and what can you just grab off the CVS or Walgreens shelf just to help yourself?
Sure. So complications that can come from environmental allergies, asthma, breathing issues, skin issues, hives, eczema. So I mean, it's not just nose. Right. Chronic sinus infections, things like that. So if you're not sure what to do when you walk into the pharmacy, think about your symptoms. So if you're congested, nasal sprays can be really helpful. Something like a Flonase or a Nasacort. If your nose is runny, sneezy, you can also do a nasal spray called Astapro. And sometimes people will use a combination of Flonase and Astapro to help. If you're overall just like itchy, just feel terrible, get an over-the-counter non-drowsy allergy pill. Something like Allegra, Zysol can be really helpful. I usually try to not recommend Benadryl because Benadryl is short-acting and can make you even more tired.
That is a great point.
So thinking about more of those 24-hour relief allergy pills. Also irrigating your sinuses with saline, just getting it all out can be really, really helpful.
So saline in the eyes, we're seeing a lot of red eyes as well. And then you were saying that pollen can cause skin rashes, dermatitis. Talk about that.
Yeah, so exactly. If you have a pet and you're allergic to your pet, or your pet carries pollen and you're touching that, it's going to make your skin break out. If you're allergic to dust and there's dust in your bed, you're going to make your skin's going to break out. So, you know, it's not just sinus, it can affect all body parts. And really, I mean, if you're not sure where to go, obviously you can go see your allergist, you can get testing. You can even think about allergy shots. I mean, if you're really miserable from these symptoms and over-the-counter medications aren't working, it's reasonable to think about allergy shots as a way to get desensitized so you don't have to deal with these environmental allergies anymore.
Well, there you go, Doc. Thank you for helping us realize we're all not crazy or sick all the time.
It's your quality of life. I mean, these types of allergies are not necessarily life-threatening, but if it's a quality of life. If you're miserable every day because you can't breathe out of your nose, it's time to get help.